Thank you everyone for joining and happy Wednesday. I hope everyone had like a longer weekend and got the extra day off for Labor Day. My name is Jaquarius Jackson. I work with the wellness team here at Baylor Scott and White. And again, thank you all for joining on our webinar today on sickle cell awareness. I'm going to take a few minutes to introduce everyone we have today because we do have a really big fun panel today for our webinar. Again, I work with the wellness team and we have these webinar presentations at the top of Wednesday every single month. We have the webinar presentations completely open to anyone to join, and just really our purpose is to inform the community on a lot of different health topics that are out there going on, and we chose sickle cell awareness for this month. Our first panelist I want to introduce today is going to be Dr. Hart, and then Dr. Hart, if you want to go ahead and take a few minutes to introduce yourself.
Sure, thank you. Thanks for the introduction. My name is Anita Hart. I am a practicing internist, and I am the Baylor Scott and White Health Plan Medicaid medical director. So the medical director over First Care and Right Care. I also have been blessed to be involved with the sickle cell task force with the state of Texas and that group. So happy to be talking to you today. Thanks.
Awesome. Thank you, Dr. Hart. Our next two panelists we're going to have today is going to come from our a foundation that we'll hear about later on in our presentation. Our next presenter I want to present is going to be Kenya with Carol's Promise. Can you want to go give a little background about yourself?
Sure. My name is Kenya Buckley. I am the founder and executive director of Carol's Promise Sickle Cell Foundation. It's we'll get into more specifics later, but I created the foundation back in 2007 just to provide resources and services to people living with sickle cell.
Awesome. Thank you so much for that. And then our next panelist I'll present today is going to be Tamara. She's going to be our sickle cell warrior for today. Tamara, you want to go ahead and introduce yourself?
Absolutely. Greetings. Hello, everybody. I want to thank Baylor Scott and White for having us in this beautiful space that is carved out to raise sickle cell awareness. I am Tamara Faye Neal, a warrior and advocate for a illness that I have lived with my entire life. So I'm so happy to be in this space with Dr. Hart and founder Kenya Buckley. And thank you, Mr. Jackson, for having this space. You'll hear from me later in my lived experiences. I am a graduate of Texas Women's University with an emphasis in public health because I always knew that I wanted to come back to our warrior community and advocate. And being in Carol's Promise, one of their board members allows me to be that warrior advocate. So happy to be here, and thank you all for joining.
Awesome. Thank you so much for that, Tamara. Before we get started, everyone, I want to remind you all that I really want this to be an interactive presentation. If you all take just a few minutes to look down at your screen, we do have those three buttons at the bottom, and that's where you all can be interactive with us today. That's going to be the option for that chat feature, and you can put any questions that you have down there at the bottom. I will say we're going to try to leave most of those questions for the end of our presentation today, just due to time, but I promise we will get to all the questions that you all have. And just please, as we're going throughout the presentation, drop them in there as you kind of see fit. Just as an overview of what we'll talk about today, we're going to just kind of understand what sickle cell disease is. So if some of you are new or just don't have really much of an idea of what the topic is going to be about today, we're going to dive directly into what it is, but then discuss some risk groups along with the symptoms as well. We'll review what a sickle cell actually looks like compared to a normal cell, and then understand what it looks like living with sickle cell as well. So before we kind of dive into things, I want to introduce Tamara once again as our sickle cell warrior, and let Tamara share her just kind of experience living with sickle cell a little bit, and just some things she's experienced with it, and just some thoughts that she has that she'd like to share with the group as well.
Hello again. Absolutely. I am well, I'm gonna age myself. I'm gonna date myself. But I'm very happy to have to see 40. So I was born in the 80s. I'm a 40-year-old mother, professional, advocate, and community organizer living with sickle cell disease. I found out that I had sickle cell when I was in third grade, right? My mother found out when I was 3. In the 80s, they really didn't do any screenings, uh, unless unless one, you had medical care and access. I grew up in a household that was on Medicaid, Medicare, and things like that, governmental healthcare. So my mom didn't know to get me screened. It was when she found that I would get pale a lot, and she would keep me home from school because she didn't want people to think that, something was happening to me at home, or she, had to protect us and herself as well. So she one day I was sitting on the toilet and I was always constipated. Always, I know this is a little too much, y'all, but I was always constipated. And so she walked into the bathroom and I had fell in the toilet. And she said, she was like, Tamara, you were so frail and I didn't know why. I felt like I was feeding you enough, and you would be very famished and you would, pass out a lot. And so she ended up taking me to Children's Medical Center, where I met, she ended up taking me to Children's Medical Center where she met Dr. Buchanan. I didn't know who he was at the time, but he's a decades long doctor and provider for pediatric sickle cell in the city of Dallas. And so I don't think she was ready to tell me what I had yet. She did wait until I got into the third grade, because she felt like that is when I would understand what was going on. So when I got in the third grade, I did realize that I had sickle cell disease, and it was described to me that it wasn't described to me as a blood disease. It was just described to me as you're going to be tired a lot and you have something that's going to make you sleepy. So we have to make sure that you are alert for your work, or if you can't go to school, you will get, your teachers will allow you to do your work at home. So even when I found out about sickle cell, I didn't know it was a blood disorder. I just knew I was always tired. I just knew that I always wanted popsicles. And every time I went to Dr. Buchanan's office, he would give me popsicles and I would be like, I love this place, but it was the care under that a children's medical center care that I really understood kind of what this fight was and what knowledge I would need, and how, even with my mom, we were growing up together, I feel like. So how to, navigate sickle cell. I would learn some things, she would learn some things. She would make sure I would go to Camp Jubilee where people that are like me were there. And so it's really amazing to see the trajectory of the care in sickle cell for pediatric. When I found out I had sickle cell, also for transition, those teenagers, and then it's adult care. I'm extremely ecstatic to see um, what has come of all of the hard work whether it's at the federal level in Austin or the local level, the state level. I'm just, the federal level in Congress or in Austin at the state level or locally in Dallas. I'm just very happy that the tests are ran now. You understand what the full breadth of your diagnosis is. You can ask more questions. I feel like back in the 80s and 90s, I couldn't ask questions. I was just like, well, I'll just, you know. And my mom, sometimes parents feel like they did something wrong and they have absolutely no control over, you know what I mean? Sickle cell. So it's just, I'm grateful, I'm very grateful. I'm still here and I have a story. And when I graduated college, I made a commitment to go back and advocate for sickle cell in whatever capacity I could. And that's when I started my adult care with Dr. Alicia Nero. And when she found out I wanted to advocate, she was like, I have the perfect space for you. And she navigated me towards Carol's Promise, which was literally providing a different level of restorative care, I say. Just a space to restore the mind, body, and spirit of those warriors living with sickle cell disease. And they pay attention. They pay attention to their members and warriors and what do you call that? Providers. They pay attention to um, I can't think of the word, but more so just like paying attention to the people that are living with sickle cell and those in transition and those in adult care. So I have the luxury of, serving on their board in representation of the warriors, which is very smart on Kenya's behalf to have a warrior advocate in this space to really be able to speak the language. And that's a little bit about me.
Awesome. Thank you so much for that, Tamara. Thank you for your courage and your strength, and awesome, and definitely for sharing your story for all of us on the call here today.
Thank you.
So as we're going to transition a little bit here today, we're going to move over to Dr. Hart, who's going to share a little bit about the science of what sickle cell disease is.
Thank you. And Tamara, thank you so much for sharing your story. I think having the patient voice represented is really critical for people understanding that this is something that you carry with you and that you have to manage. And it's a journey that can be challenging. And it sounds like you've found a community in between your doctor's visits to help support that journey. And I think that's really wonderful. In sickle cell disease is a blood disorder. So we'll just start with that. It's a blood disorder that primarily affects people that have ancestors that have lived in malaria belts. So there is a genetic change that happened in people's DNA that would help them survive malaria in a malaria endemic area. And so it can affect anybody who's lived in a malaria endemic area. There's a misperception that it's only that it only afflicts Black people. It does not. And there'll be more discussion about and representation showing the types of people it does affect. But basically what the bodies naturally did to avert a serious illness by over time selecting for a mutation that allowed people to survive a malaria endemic, wound up having more impact to their health if they get not just one copy, but two copies of the gene. There are some other genes that are involved that can also be contributing, like beta thalassemia 0. So if you get one copy of the sickle cell gene and one of beta thal, you can wind up having the same symptom complex and same course of treatment and your journey similar to if you have two copies of the sickle cell gene. And then there's the C variant, so you can have a sickle S gene and a sickle C variant, and you can also have manifestation of illness that way. And so what I think what people need to picture in their mind's eye, and we borrowed these sickle cell images from the National Heart, Lung, and Blood Institute, which has fantastic resources. I would encourage anybody who wants to know more about it, clinicians or warriors and their supporters, to go there and avail themselves of the materials. But if you can see on the left-hand side, that is what a normal red blood cell looks like. We have multiple types of blood cells. Red blood cells are the ones that carry oxygen. And so they're kind of rubbery. You can see that they're able to get through little narrows and go around the corners, and they're very flexible. And with sickle cell on the right, you can see that you can wind up having an abnormal shape that gets stuck in certain areas. And then that can cause something that we call vaso-occlusion. Vaso meaning the blood vessel, and occlusion meaning a blockage. And then we talk about something in medicine called a vaso-occlusive crisis, which is when there's too much blockage that is in a certain area and causes pain or physiologic changes, and is a manifestation of the illness. And so on a very basic level, this is what's happening. Now, you heard Tamara talk about them mentioning if she was tired or was a little bit more pale. That's because normally if someone does not have sickle cell disease, on average, your blood cells last 120 days. If you have sickle cell disease, you can wind up having your blood cells only average survival is about 2 weeks. It can be. So there's a more rapid turnover of those cells in addition to them getting stuck in places and not being able to move around. Tamara was telling you about her experience not understanding until, like, her mom not knowing until she was 3, and then her not knowing until she was in school that she had sickle cell disease. In 1983, Texas started a universal screening for sickle cell disease when children were born with a little blood test that goes off to the state. So every newborn in the state is now screened, and this is nationwide in the U.S. But various states adopted it at different times. So that gives someone the opportunity to know if they have the gene and how many copies of the gene they have. It's important for parents or people who are desiring being parents to know this information because it takes 2 copies of the gene, and you can get one from each parent in order to manifest this illness in the children. So it's nobody's fault, right? This is something the body did to protect itself from a serious infection that is life-threatening in a time where we didn't have medicines to prevent that. And, malaria is alive and well, even now. Last year, I don't know if you guys had noticed on the news, but malaria was making its way up into South Texas. Now, that's important because babies up until the age of 3, so infant to 3-year-old who have sickle cell disease have a worse outcome if they get malaria. So simple things like using something to deter insects would be something that would be preventive, that could be used. And in Medicaid, actually, that is covered if it's given by prescription from your doctor. So we have new ways to screen. We have ways to share that information with people, and then allow them to get ongoing care and preventive care and manage the journey that they're on. So oftentimes, children don't manifest any symptoms for several months, 5, 6 years old. But early symptoms could be that their eyes turn a little bit yellow. In the whites of their eyes, their skin might turn a little bit yellow. The earliest sign is if you look underneath the tongue, there's a little bit of yellowing there. Interestingly, women, mothers, most of the time will notice this better because they can perceive the color a little bit sooner than men can. The fatigue or fussiness from anemia, so there could be some paleness. The paleness usually shows in the hands. It can also show in this little spot underneath your eye. If you pull your eye down and look, it should be nice and pink. If it's a really pale pink, that's also a sign of having some anemia. And then there can be vaso-occlusion, so swelling of the hands and feet, Oftentimes, one of the earliest manifestations is something called dactylitis, but basically it's a finger. A finger gets occluded with the vaso-occlusive crisis and it swells and it becomes very painful. So those all can be early manifestations, and there are many other manifestations that can happen, but those are early clues for babies. And so the symptoms can change over time. One of the most concerning things that we talk about, I'm a hospital doctor, so I see people when they're sick enough to come in the hospital. And so one of the most concerning things that, we manage in the hospital are occlusive crises, whether it's in a joint, whether it's in the abdomen, and then a very important occlusive crisis that can coexist with infection, which is acute chest syndrome. We take that very seriously. Of course, having low blood count can also cause its own issues, and people have been hospitalized to get transfusions. Sometimes they get some of their blood taken out and then blood put back in, but it's not that common. Oftentimes you just get a transfusion. There's been progress made, and this can be a painful realization that regarding how much time it took to get this progress in the warrior community and their supporters. And so I think that one of the oldest medicines that we have been using that can start as early as 9 months old is called hydroxyurea. It's older. It's been very well studied for a long time. There are side effects. Pregnant women can't take it. Women desiring pregnancy can't take it. But that's a mainstay, and it can start very early to prevent those sickling crises. And then I think one of the things that we tend to forget about is how important vaccines and antibiotics are. So all of the childhood vaccines are incredibly important. There are 3 that are specifically important for the specific risk that sickle cell warriors have. And that is that there's bacteria that have what we call a jelly coating. We call them encapsulated bacteria. Pneumococcus and meningococcus and Haemophilus influenzae B are the 3 bacterias. Those bacteria can evade the usual immune system responses because of this like jelly coat that they are surrounding themselves with. And the part of the body that takes care of that for us is the spleen. And the spleen is a very vascular area. And as you can imagine, if you have a disorder that will cause areas of vasculature to get occluded, then it won't function as well. So it's really important that those vaccines get taken, all the childhood immunizations, plus flu, plus RSV for the young children, because your chances of acute chest are so much higher. You want to prevent anything you can. And then antibiotics. Antibiotics go until the age of 5, and it's everyday antibiotics to prophylactically prevent those problems with infection in the spleen. So that's 2 ways that you can counteract and prevent some illnesses using easy to use interventions. There are pain medicines that help reduce painful crises. Some of the medications like hydroxyurea also decrease the incidence of crises. Sickle cell patients often get a lot of transfusions. Sometimes they can get iron overload, and there's medicines to take the iron overload away because iron's in your blood cells. If you get lots of blood cells, then you can wind up with iron overload. Your body is making so much more blood than normal that there's a vitamin you can take called folic acid that helps with the blood turnover and is available over the counter. Pregnant women use the iron and folate together when they're anticipating getting pregnant. So, so iron you'd have to talk to your doctor about if you were anticipating pregnancy. However, folic acid should be used anyway. We talked about the transfusions. You know, one of the only ways to cure right now is a bone marrow transplant. It's a very intensive situation, not without serious consequences, and, you know, not really taken upon lightly. Usually, people have to go through multiple different medications in order to get to the point where, you know, they're looking at whether or not the bone marrow is going to affect not only a cure but their quality of life. Is there not another way we can manage the disease? And then, and very exciting new treatments, genetic treatments, have come up in the last couple of years. I think it was about 2 years ago, I was reading the NIH director's blog and he was talking about it. And it was just such a triumph for science. It's still very early to know about those treatments. They haven't studied them long term. So the side effects, we don't know the side effects long term. One of them is, you know, basically doing taking the body's own blood, isolating stem cells, using gene editing to modify the gene, and then putting it back in. It's very exciting, and the treatments can last about a year. Also incredibly expensive, as everybody is aware. Good news is that the federal government is trying to find a way to minimize the cost for that. And the state of Texas has sent in a letter of interest saying that they would like to be part of that bargaining agreement if they were able to do that. These new technologies can wind up becoming prohibitively expensive. So I'm delighted that the state of Texas is working with the federal government to see if that's something that that can hopefully bring this to members. So things that can be done, you know, living a healthy lifestyle. And so, you know, working with your doctor to have a plan, staying active, staying hydrated, you know, getting good sleep, all the usual. You know, I talked a bit about preventing infections. It's so important, can't be stressed enough. And I just want to mention this to you because this is a great website for those who, anyone really, but those who need families who are looking at transitioning a teen into adulthood. And Tamara talked about how that can be a little bit bumpy, that transition. And so I think that this resource is available for anybody to look at. And I would encourage you all. So with that, I'm going to turn this back over to Tamara to introduce Carol's Promise and her work there.
Thank you so much, Dr. Hart, for all of that amazing information and data, scientific understanding, and education on what sickle cell is and a little bit about how to transition. So I want to introduce the founder of Carol's Promise, Sickle Cell Foundation, that is working in the DFW area, founded in 2017. The founder, Kenya Buckley, um, made this promise to her mother, Carol, to advocate on her behalf. As we call her, Mama Carol lost her battle with sickle cell in 2005. And Carol's Promise is doing a great job blossoming into a premier community-based organization. So I want y'all to hear from Kenya Buckley and the work that she is doing for advocacy, awareness, and education in DFW.
Dr. Hart did a very great job of defining sickle cell, and Tamara did a great job of her patient experience. But I like to just put visuals behind things. So with sickle cell, imagine you're being struck by lightning over and over and over again, and there's nothing you can do about it. Imagine being stabbed by a knife over and over and over again. Imagine your bones crushing, or it feels like your bones are crushing over and over again. So this is why I'm so passionate about sickle cell, because those are the feelings that my mother would explain to me, how she was feeling. Like that's how sickle cell felt to her. And so, who is Carol? Carol is my mother. I founded the foundation in 2017 in her honor. I watched her suffer with this disease for many, many years. She ultimately um, lost her battle with sickle cell May 31st, 2025. So I watched her suffer with the disease with no resources, with no support. And so I made a promise to her that I would advocate for sickle cell warriors on her behalf. And so I created this foundation just to provide services, provide resources, be an advocate for warriors that go through the same experiences that she did. So our mission is to provide a better quality of life for people that live with sickle cell disease, and also their families, because the families are their caregivers, and so they go through the experience with them, physically and mentally. They go through all of these challenges with them. So we just want to provide a better quality of life. We do that by raising awareness. We do that by advocating locally and at the state level. We do that by support groups. Um, we provide education to the community and also to nursing students at local colleges, local community colleges. And ultimately, we want a universal cure, a cure that's Dr. Hart spoke about the bone marrow. Um, and that's wonderful, that's great, but it's not universal. You have to have a perfect match, and a lot of people don't have the match, so that's not a cure for them. So we want to hopefully in the future have a universal cure for everyone. So let's talk about the numbers. So in the United States, there's estimated to be about 100,000 people in the United States with sickle cell disease. It's considered a rare disease because of that number, but unfortunately, there's not a database that tracks um, the number of people with sickle cell. So that number is growing and growing every day. However, there hasn't been a database to track that number. So right now, we estimate 100,000 people in the United States, but worldwide, there's millions of people with sickle cell. Sickle cell affects all ethnicities. It affects African American, Hispanic, Asian, European, and also people with Middle Eastern ancestry. There's so 1 in 365 African Americans are born with sickle cell disease each year. About 16,300 Hispanic Americans, and also 1 in about 12 to 13 African Americans are born with sickle cell trait. And it's very important. We always emphasize in the community to know your trait status, because all of the new cases that we see that come to us, all the new parents that come to us that their newborn has sickle cell, it's because the parents did not know that they had the sickle cell trait. I have the sickle cell trait, and both of my children have the sickle cell trait. That's important to know, because my husband and I, when we were thinking about having our boys, we did genetic counseling, because I knew I had sickle cell trait because my mom had sickle cell, and my husband did not know if he had it or not. He knew that he had sickle cell that ran in his family. So we decided to have genetic counseling. He got tested. He did not have the trait. And so both of my kids are fine. They have the trait. And so we, as trait warriors, as we call ourselves, we present with no disease. We present fine. And so when we're going around our daily lives and we're deciding to get married and have kids, we don't think about our trait status. And so we get with someone else that does have trait, and there's a 1 in 4 chance, a 25% chance that our kid could have sickle cell disease. So it's very important to know your trait status. It's a simple blood test. And then you know your status, and then you can prepare for your family in a healthy way, in that way. Like I said, I like to have visuals, and so I always like to share this slide so that you can see the different faces of sickle cell disease. In the United States, about the last slide, about I think it was 90% of the sickle cell cases in the United States are from African Americans, or so it's considered a Black disease. I would just like to say on this webinar that sickle cell is not a Black disease. Sickle cell is a blood disorder. It's a blood disease. So when you put a race on a disease, it creates a stigma and it creates biases. And we want to destigmatize sickle cell. So I personally know everyone on this slide, and they all suffer from the disease as well. And so we want to destigmatize sickle cell and not make it a racial thing. It's a blood thing. So if I can just emphasize anything on this webinar today, that would be it. It's sickle cell is a blood disorder. And so we don't want these people discriminated against. We don't want African Americans discriminated against when they go into the emergency rooms. We just want equitable health care for everyone. So for Carol's Promise, so a few of the things that we do is we provide these services here on the left: utility services, transportation assistance. A lot of our patients that we service don't have transportation to and from the hospital, to and from their doctor's appointments, so they become non-compliant. So we wanted to offer this service through Uber Health to make sure that they're going to all of their doctor's appointments on time, and that's not a hindrance in their health. We also provide prescription assistance and grocery assistance. So those are our 4 main direct services that we offer. We also do events and programs throughout the year. We have a support group that we offer to our patients. We do blood drives all throughout the year. We have educational based webinars such as this one that we do. And one of the things I'm very proud of is that we have an annual scholarship that we give out to a high school senior or an individual that's already in college to kind of help and supplement their tuition. So we've been doing that the last 5 to 6 years. And so the scholarship is in my mother's name. And so that's one of the things that I'm very excited about, being a first generation. I was a first generation college student. So that's just a way for us to give back to some of our sickle cell warriors. And we do many more things. I also want to highlight just a few of the accomplishments that we've had. We were given the community-based organization On the Rise that was given to us by the Sickle Cell Community Consortium in Atlanta, Georgia. And we also were advocates at this Texas stakeholder meeting at the Texas Capitol. So we were going to advocate for some different sickle cell bills to be passed a few years ago. Some of the publications, we received the Arlington Today, a local hero, a difference maker in the community publication. And I was also chosen as a featured storyteller from Novartis, and we did a whole big campaign. We did a commercial with a Grammy Award winner, Jordan Sparks, and it was an amazing experience. And so I definitely want to thank Novartis for that experience and also being a sickle cell champion in the pharmaceutical world. Yes, so these are just some pictures of some of the events that we have done and some of the programs that we have done in the community. We are located in the Dallas-Fort Worth Metroplex, so we service families all throughout DFW, but we do partner and work with other organizations that are all over Texas, in Houston, in San Antonio, in Austin. There's the Mark Thomas Foundation. But we just want to definitely raise awareness, and we thank Baylor and everyone that gives us the opportunity that where we can speak to people like you and just get the word out about sickle cell and the support and the things that we're doing at Carol's Promise. Thank you.
Awesome. Thank you so much, Kenya and Tamara, for what you guys offer to the community, and definitely thank you for your time here today, presenting to everyone on the team. And we really appreciate for what you do and sharing on your call today and being really transparent with both of your stories. So right now, I kind of open it up to questions. I'll monitor the chat here a little bit for any questions that are coming up. So if anyone does have any questions, please go ahead and drop them in the chat. Carol's Promise is over there at the top, and as Kenya mentioned, they are located in the Dallas-Fort Worth area. Even though they are in the Dallas-Fort Worth area, I did ask Kenya previously, you know, they will service anyone that is willing to come to them, and they do have people that travel to them pretty often as well. So if you're not in that Dallas-Fort Worth area and you are interested in some of those services that they offer, you definitely do have the opportunity to go visit them as well. Kenya also made that reference to the Mark Thomas Foundation, and I listed the phone number there and how to contact them, and also some regional areas that they're located in. That General Sickle Cell Association within Houston, and there's also a support group as well for parents that are also listed there. So I'll keep this slide here on the screen for a few minutes if anyone wants to grab a picture of that. And then while I keep that on the screen, I will go over to the chat that we do have some questions in. So I do have one question here, and then Kenya or Dr. Hart, if you want to grab this one. This may be a little bit more for you, Dr. Hart. Is it possible to experience symptoms as a carrier?
In general, carriers do not experience symptoms, but there are some other hemoglobin variants that can be combined with a single gene of the sickle cell that can manifest just like sickle cell disease. Beta thalassemia, so beta thal 0 is one of the ones that you can have one copy of that, one copy of sickle cell, and have those symptoms. The sickle S, one copy alone, generally not, but there are some other variants. So if you're having symptoms and have it in your family, then I think it's always prudent to talk to someone about it.
Awesome. Thanks for the answer, Dr. Hart. As a reminder, if you're on the Baylor Scott and White plan, remember we do have access to that member portal. As we talked about some of those additional testings and things like that, that member portal is going to be a great resource to where you can get some of those live results for some of those testings and things like that that you have access to. It's also going to be a great hub space for some of those communications with your primary care provider as well. Dr. Hart mentioned some of those conversations to have with your primary care provider and what some of those discussions will look like. And that member report is going to be a great resource to have some of those discussions with. We do have another question in the chat here. If a newborn is screened and found to have sickle cell, what are the next steps going to be for the parent?
That's a great question. Thank you. They're screened. They'll get notified that the child has sickle cell disease, and so that information should be shared with your primary care doctor. Important to keep the schedule of vaccinations, right? So those 2, 4, 6, there's a whole bunch of appointments early. And then as an infant, maybe even before 6 months, someone should be referred to a hematologist to establish care. And so there can be more education and also, discussions around what symptoms to look for. We talked about some of those here now, but since it is a rare illness, not every primary care provider will have seen this, depending on where they practice and whether or not the community has a larger incidence of it. So, so it's important to have that hematologist that the primary care doctor can collaborate with. And I'm also happy to share with you that our Medicaid plans, we offer care coordination for anyone with sickle cell disease. Our nurses have a special assessment that they do in combination with a general assessment that is really targeted. You know, we work together to target, you know, some of the symptoms, following up on the vaccines, trying to find out what kind of help is needed. They can help collaborate with other providers and help make those contacts so that all of that information is with one of our nursing team members. And so I'm happy to share that we have that as a resource for people. So I would encourage any members in our Medicaid plans to definitely reach out if you or your child has sickle cell. So.
I would also like to add, in addition to those things Dr. Hart mentioned, I would definitely encourage that parent to find their community, find their support community, because everyone's sickle cell presents differently. And so I've seen in cases where everything that the caregiver and the patient is doing that the doctor is saying to do is not working. And so they've gotten with their community and found things that work for them. And so also so that they don't feel alone, because this disease can isolate you and make you feel like you're alone and nobody else is going through what you're going through. That's similar to what my mom was going through. But if they have a community that understands what they're going through, go to the camps that are offered, find support groups, those things help out a lot.
Yeah, I think it's wonderful that you mentioned that. Anyone who's diagnosed with a rare illness is in a very unique situation in that there isn't like a natural community available, and that the information isn't as universally dispersed. And so I think having that, and knowing, who to go to, how it manifests, it helps with probably the symptom that we don't talk about as much, which is just the heavy weight of having an illness and having an illness that's rare, and that we're still developing therapies for. And so I think that the burden can be alleviated in ways that you won't find in the clinic. So I certainly appreciate that aspect of it, and support everything that Kenny just said.
Gotcha. Thank you, Elise, so much for that answer. First of all, thank you so much to all of our panelists that joined on our call today. Thank you all for your time, and thank you all for what you do every day to service the community. I do want to remind everyone on the webinar, I do understand this is your lunch hour, so thank you all for your time as well, just getting on here to learn some additional information about maybe a new topic to you, or maybe you just wanted to learn some additional information about something that you are familiar with, or maybe something that you currently have some information on as well. As a reminder, we do these webinars on a monthly basis. And again, we're just giving these webinars to have some additional information about some of those different health topics every single month. Our next webinar is going to be on October 2nd, and it's going to be about dental health. So there's going to be the next opportunity to join us on another webinar topic. There is one last comment in the chat, ladies, just to all of you, and it says, thank you, ladies, for all the information. You all amazing. And I definitely second all of that to what you all do on a daily basis. So without that, that'll be kind of the last kind of tie up here, ladies. So thank you all again. Thank everyone, all the participants that joined today. And that will be the end of our webinar today. So thank you all again. And we definitely look forward to hearing more about ways that you all continue to service the community.